Hello again, everyone. It's Dr. Thorpe. We're back for our next Q&A. Welcome back to everyone that's joining me this evening. I'm going to give people a couple minutes just to get on, but I'm so happy to have us back having another discussion. And I think this is such an important discussion this evening about medication compliance. So, over the past few weeks, I've been talking about the American Medical Association 8 different reasons as to why patients don't take their medicines. And I've offered a few different solutions for each one that I hope has been helpful for some of you. So I'm going to give just a quick kind of summary of the things that we've talked about thus far. And hopefully, once I give that summary, that will help some of you to understand the things that I've been talking about thus far. If you weren't able to see the videos, and then we can get into whatever questions you guys have. So basically, I want you to type whatever questions you have into the chat box. If you are not logged into YouTube and you're unable to type your question in the chat box, you can catch me and send me a message on any of my other social media platforms at Amize Health, which is on Facebook, Instagram, Twitter, or um, TikTok. So you could send me a message there. I'll be happy to answer your questions in here. So I'll be checking there periodically just to make sure that, I'm not missing any of the questions that you have. So once again, welcome to everyone. I'm really excited about having this discussion with everyone because, like I said, it's a critical conversation to have because as a physician, many of us, I would say, um, we deal with patients oftentimes not taking the medicines that the way we intend for them to take it. And there's so many barriers for why patients don't take their medicines the way that they should. And we're all human. We try to be understanding, and I do think that for some of the reasons, there are things that we can do to kind of get around the issue that you're having, so that we can make sure not only are you taking your medications, but it's getting you on your path to your best possible health. So like I mentioned before, I'm going to give you a quick summary or a quick kind of run through of the things that we talked about. Now, the 8 different reasons as to why patients don't take their medicines as prescribed, according to the AMA, are fear, cost, misunderstanding, just taking too many medicines, having a lack of symptoms, mistrust, which is a huge one in the African American community, worry, and depression. And so the things that we talked about really are that, fear, oftentimes it's because patients are afraid of what the potential side effects may be. And with that, really, it typically includes having a conversation with your doctor. One of the things that I kind of kept harping on throughout each of the previous videos was that you really should be having a discussion about your medications with the person that's prescribing them. And the reason why I'm saying the person that's prescribing them, another doctor may be happy to answer your questions, but you really should be getting the explanation from the person prescribing them because they know why they're prescribing it for you. They're the ones initiating the prescription. So you really should ask them. But for whatever reason, if you're not able to ask that person, maybe ask one of your other doctors if you have multiple doctors. Or when you go to pick up your prescription at the pharmacy, the pharmacists typically are able to answer questions for you also. So discuss those questions, whether they're old medicines or new medicines. Talk about them, ask questions. Don't be afraid to ask questions. Now, when it comes to the side effect of medicines, um, it doesn't necessarily, every medicine, no matter what it is, every medicine will have a potential side effect. Now, does that mean you will experience those side effects? No. So some side effects are more common than others, but it doesn't necessarily mean that you will experience them. But we do want to inform you and make you aware that the possibility of a side effect does exist. Um, The other reason that patients sometimes don't take their medicines the way we intend is cost. Cost is a major barrier, um, because high cost oftentimes will lead to patients just not picking up their prescriptions. In one of the videos I talked about, sometimes for some people, they have to make the choice between having dinner and taking their medications, their prescription medications. And, no one really should have to make that choice. But I think, I am thankful that, you know, having a conversation with us helps us to understand where you are and may be able to give us some solutions that may be helpful for you. Some of the solutions are there are generic versions of many medications. And so, if you are prescribed something that is the trade name for a drug, um, what happens is if we prescribe the generic medication, oftentimes the generic version is cheaper. Some pharmacies will even have like a list of medicines that they are either given for free or at a significantly reduced cost. So it's just more cost effective for patients. The other thing is sometimes trying a different pharmacy. Some pharmacies will have coupons or coupon savings programs that we can basically refer you to. So this is another thing. Conversation and communication is just so important because that's going to be the best way for you to get over some of these major barriers about filling out medications and getting your prescriptions. um, One of the other things too is that sometimes when we prescribe medicines as physicians and clinicians, we are not aware of every single medicine that is on every um, formulary for the insurance company. So, like, let's say that one medicine A is on the formulary for Blue Cross Blue Shield, but may not be on the formulary for United Healthcare, or vice versa. We're not, going to know every single one that's on the formulary. So sometimes all it is if you say, hey doc, this may be a problem for me, we can check to make sure that this is on the formulary for your insurance, because likely then the insurance will cover, if not all, they will cover quite a large portion of your copay. So it's just finding out that information. Then the next thing that we talked about was misunderstanding, when patients don't understand the need for the medicine, the nature of the side effect, or the time it takes to see the results. So basically, what that means is if I prescribe you a medicine, you need to be able to understand what exactly is the medicine for that you're taking. Um, what is it targeting? If I give you a medication for your blood pressure, you need to know this medicine is for your blood pressure, or that medicine is for your migraines, so that you know what you're taking the medicine for. I would explain to you what the potential side effects may be, what to expect, how much time it takes to see results, because some medicines, like the blood pressure medicines, you might see results very quickly, within a day or two, or sometimes even sooner. And other medicines, like medicines for anxiety and depression, they will take weeks before you start feeling the effect or seeing results from those medicines. So, really understanding what the time course is of a medication is important. Um, then taking too many medicines. This one I talked about in our older population, but we're seeing it more and more frequently in younger patients also, that many of us, many patients are just on a lot of medicines and they feel like the pill burden is just too much. Um, taking something in the morning, in the afternoon, in the evening. And again, with those, one of the things that we can do is sometimes we can combine medicines. There are medications that, let's say, if you are on two blood pressure medicines, there are some formularies where those medicines are combined into one product. So you're only taking one pill, but it's actually still the same two medicines. The another alternative is sometimes for some medications, the prescribed dose has to be taken, like I said, morning, afternoon, and evening. But they'll have what we call a long acting version that you only have to take once a day. So, there are ways for us to kind of get around that. Not always, it doesn't work for every single medication or every single condition, but it's absolutely worth a try to decrease your pill burden so that you feel more in control of the medications that you're taking. The other thing that I wanted to talk about is lack of symptoms. Sometimes, and this happens so frequently, sometimes we take medicines and it does what it's supposed to do, and you're feeling fabulous, you're feeling great, and you're like, what I need this for? I don't need to take this medicine no more. I don't feel anything. And so you stop taking it, but that's not the way to go, because what happens is with some medications you can get rebound of symptoms, which basically means the symptoms comes back, but not only do they come back harder or stronger. The other thing that can happen is you stop taking the medicine and you go right back to where you were before. The reason why you were feeling so fabulous is because you were taking the medicine and it was doing its job. And so, I want you to keep that in mind when you think, okay, I'm feeling fine, I should stop taking the medicine. No, you're feeling fine because the medicine is working. So keep taking the medications as prescribed. Okay. And then the next one is mistrust. And again, mistrust is a huge one, especially in the African American community and in the minority community, because, there is the long history of, clinical trials being conducted in African American patients inappropriately, inhumanely, and that brought, or the other part of that is medicines that have been evaluated primarily on non-minority populations or Caucasian populations, and then being used in minority populations, and not work as well for minority communities. There are a lot of reasons why they mistrust the healthcare system. But I will say this: many of us, myself included, who are minorities, are really working hard to dispel a lot of the mistrust that's going on. Um, we want to practice what we call evidence-based medicine, which is things that have been tested, shown, we understand how they work. We want to make sure that this is what we're using in our minority populations. This is what we're using in our patient populations, irrespective of what your gender or race is. So we are um, basically making strides. There's still a long way to go, but we are making strides in terms of making sure that minorities are included in the studies in a humane way, in a way that is protective of us, um, so that we are included in the population, so that when the medications are tested, we know that they are going to work for us also. There's that aspect of it, but then the other aspect of it is sometimes we go into hospital systems, and we don't see people that look like us often enough. And so there's some mistrust that comes from that too. But I will say, the key really is finding a doctor or finding a clinician that is going to work well to make sure that your health is well. So, regardless of what they look like, you want to make sure that this is someone who's taken your best interest in terms of your health into account when they are prescribing and when they're caring for you. If you have negative interactions with physicians, which many patients have said to me, if you have had negative interactions with physicians or other clinicians, and you're like, that's the reason why I'm not going to the doctor, that's why I don't see anybody, let me just tell you, there are other physicians out there. Okay. So, and we care. So try to dust off whatever the negative experience that you had is. And I know that's easier said than done, but try to just find another one of us, because we are happy to take care of you. Okay. So the next one is worry. And sometimes people get worried that they're going to be dependent on a medicine. And again, that's conversation, because sometimes patients don't understand, or you guys don't understand, that not every medicine has an addictive potential. So just because I prescribe something for your diabetes, it doesn't mean you're going to become addicted to it. If I prescribe something for your pain, it doesn't mean you'll become addicted to it, unless the ones with a higher addictive potential are those that are controlled substances. And that's why they're controlled. And we're extra cautious in who and how we prescribe those medicines. So, not to say that we're not cautious with others, but there is extra precaution placed on those because of their addictive potential and because of the potential side effects. So the worry, I think, to overcome that really is doctor patient communication. And I know that I harp on this a lot, but really this is a platform that I stand on. I really want the communication between you and your doctor to become better, because I want you to trust the person that is taking care of your health. Your health is really the most precious thing. And then the last one that we talked about was depression, because, a lot of times when we get into, there are people that are clinically depressed, and some of us just get into this funk, or some of us, we get so busy that we forget that we should be taking, I was, like I was working so much today, and, because of all the work that I was doing today, I forgot I had to take my blood pressure medicine, and now my blood pressure is sky high. It's that kind of thing. So we want to make sure that we have support systems in place to help us to remember, whether, if you have children, and I mean, typically I mean adult children, but if you're someone who have children, or you have a spouse, or you just have a friend, somebody that's close to you that you trust, these are all people that can participate and help you to say, hey sis, hey bro, or hey dad, or hey mom, did you take your medicines today? Just to ensure that you're staying on the right track. And the more consistently you do it, the more it becomes second nature, so you don't forget. Okay. And these are things that I really want people to take into account, especially for our patients that are depressed, because sometimes in the depression process, you just are not seeing a way out. And sometimes, it becomes, like I said, easy to forget, but that support system is important. Or if you don't have a support system, because some of us, unfortunately don't have the kind of support system we would like to have, if you don't, set an alarm, set a reminder that goes off every day at a certain time, regardless of what you're doing. Take medicine, take your medication. Okay. These are all things that we can do to work on getting us to the point we are, where we are living and having that amazing health that we keep talking about. So I've been talking for a while now, and I'm really excited to see what questions that some of you might have. Now, like I said before, type any questions that you have into the box. If you don't have any specific questions, or if you're not signed into YouTube, excuse me, if you're not signed into YouTube and you need to ask a question, you can always send me a message on one of my social media platforms at Amize Health. I'm going to keep checking them, just to make sure that I answer whatever questions you all may have. So right now, you can contact me at Amize Health at basically Facebook, Instagram, LinkedIn, and TikTok. So any messages to those, I'll be happy to answer. I'm just checking those right now. If you see me looking up, I'm not looking away from you. I just want to make sure that I don't miss any questions that you guys might have. Okay. So since while I wait for those of you who are on to kind of chime in, I'm gonna go ahead and start answering some questions that were already sent in to me. So one of the questions that I got is it possible to get a side effect that's not listed for my medication? Yes, it is. This person is saying, for specifically, if taking it with another medication that's not tested. So for instance, I think what you're talking about are like supplements or herbs, things like that. So It is possible to have a side effect that you did not see for your medication, because typically, unless you read through the entire printout that you get from the pharmacy about the side effects, usually what happens is only the most common side effects are listed at the top. So those are the ones that we typically hone in on. The ones that happen in less than 1% of the population that's tested tend to be lower down on the list, and sometimes we miss those. So yeah, you can have potentially have a side effect from one of those medicines, or if you take it with a herb or supplement, and that they basically interact with each other, you could potentially get a reaction from that, or an adverse effect from that. So that is actually why it's so critical that patients are forthcoming with all the medications that they're taking. So sometimes people get annoyed when I'm like, hey, Miss X or Mr. Y, tell me, what medications have you been prescribed? But I don't stop there. I say, what supplements are you taking? What herbs are you taking? And I think when people get frustrated with me, I then give the explanation. The reason why is because I want to know if these medicines are potentially interacting with each other. But not just that, if you're coming to see me for, and I have diagnosed you with a new condition, I want to make sure that whatever medicine I'm going to prescribe you is not going to interact with something you're already taken and potentially cause you harm. So at the end of the day, we just want to make sure that you remain well, and that we adequately treat whatever the condition is you come in for, without causing you any harm. Okay, I hope that was, I was able to answer that question. Um, so the next question that I just saw posted is, how do I learn about drug interactions? Is my meds affected by cranberry juice or grapefruit juice? That's a great question. So the ways that we typically recommend is for, I have been saying this a lot, but really ask your doctor, because we have systems where we actually can check the interactions. So we basically can put in all your medications and check to make sure that they're not interacting with each other. And then grapefruit juice in particular do have some interactions with some medications. So usually, when it comes to medications that are impacted by grapefruit juice, or common things in the diet, um, we usually let the patient know that cranberry juice is not one that is very common, that I'm aware of any specific interactions, but grapefruit juice is one that can cause interactions with some medicines. And so that is something that your doctor should really let you know about. I know that everyone thinks Google is their friend, but it's only your friend to a certain extent. You can potentially Google the medicine you're taking and check against, grapefruit juice. But again, the best way to do it is really to ask your doctor, because Google can sometimes give you so many lists of things that cause you to go into alarm mode. Uh, and that's not what we want. But usually, if you're being prescribed a medication that's going to cause an impact, usually you're told, or you should be told. And if you're not sure, ask. Um, and one of the common things, like for instance, like warfarin or Coumadin, the blood thinner, one of the things is, because of its mechanism of action, we typically talk to patients about, eating green and leafy vegetables and how that can impact the medicine. So that's just one example of what I'm talking about. So the question that you asked, you're absolutely spot on in terms of medications can absolutely be affected by some of the things that you're eating or drinking. But the best thing to do is really to ask your doctor about it, to make sure that there isn't any interactions. Usually, commonly, um, it's not brought up. Like, let's say, for instance, grapefruit juice. I wouldn't tell a person that I prescribe a high blood pressure medicine to, oh, hey, this does or does not interact with grapefruit juice, because that's very specific. I would only bring it up in the context of, if this is something that will be affected by grapefruit juice, then I will tell the patient. So it's possible that maybe your doctor did not say anything to you about it because it does not it does not affect that medicine. And I hope that answers your question, and I hope that makes sense. Okay, any additional questions, feel free to go ahead and type them into the chat. Um, so right now, I'm going to go ahead and ask another one of the questions that I got, which is, I this is a good one. I believe all drugs and medications are evil and only take herbs and natural remedies. Why are these not recommended more? And that's another great question. So very few herbs and natural remedies are recommended in place of prescription medicines. And part of the reason for that is because the scientific community understand and have done extensive testing on how prescription medications work. So we understand their mechanisms of action, and how they would interact with each other because of those mechanisms, and how they interact with different receptors in the body, things like that. However, with herbs and natural remedies, a lot of them we don't fully understand how they work. So there's that part of it, uh, and then the other part of it is that for a lot of herbs and natural remedies, because they're not under FDA regulation in the same way that prescription medications are, there is no way to know that each dose of the medicine is actually the dose that they're saying is being given. There's no way to know for sure that everything that's in the medicine or in the supplement is what they say is in it. So there could be other things in it that we're not aware of. That's one. Two, we may not know how they work. But I will say this, because I know a lot of you might get upset at what I just said, but I will say this. You know, Chinese medicine has been along for hundreds of years. And for those of us from the Caribbean, like I am, or from places in Africa, there's been use of certain herbs or certain things for long periods of time. Grandma says to take this because this is what has been used and it helps your cold. And, if you have an upper respiratory infection, use this. So when I say, we don't recommend necessarily taking herbs and natural remedies all the time, it's because we don't have a complete understanding of what those herbs are. Now, if your grandma or, someone that has been using a certain medicine over a long period of time, that's their own version of testing because it's been used for centuries in a certain way. However, the issue that we come into is when you take that medicine now and you're taking prescription medicines and we don't know how that medicine work, we also then don't know how they interact. And that interaction sometimes can cause you harm. And I don't think we fully, as patients, we don't fully always understand that and don't see anything wrong with it. But I will say that I would caution people on just taking natural herbal remedies and along with prescription medicines, not understanding that there may be interactions between the two. So definitely tell your doctor what natural remedies or herbs you're using, okay? Because it is critical that you do because of those potential interactions. I hope that was able to answer that question. Any additional questions for me? And again, I'm going to go ahead and check social media. You guys can send me messages on social media, questions on social media. I'm happy to answer them. Okay. So another question that I got here is, why don't we have more medications that treat multiple conditions? And I would say that there's a somewhat complex answer to that. So medicines that have a specific target will in turn have some side effects based on that target. Having one medicine treat multiple conditions usually happen when a side effect of one medicine happens to treat a different condition. It's typically not set out to do that necessarily. Um, there's no guarantee also that the same conditions will happen in each person. So, like for instance, I know I talk about hypertension or high blood pressure and diabetes a lot because I have a lot of those kind of patients. But let's say that, a lot of people who do have high blood pressure or who have diabetes also have high blood pressure, but a lot of people who have high blood pressure doesn't necessarily have diabetes. So if we, let's say we had a medication that like treated both diabetes and high blood pressure at the same time, um it wouldn't, so for all those people that have high blood pressure, they would not be able to take that medicine because it's also treating diabetes. Does that make sense? I i also wanted to say that increasing combination drugs, so like let's say you're putting different drugs together in order to treat multiple conditions into one, it increases the other side effects. So the effect profile may have been, let's just say, as an example, let's say that the potential side effects for taking medicine A is five different side effects. um, when you now have another medication on it, you add medicine B, and medicine, let's say medicine B has 10 side effects. When you combine them, the potential for the side effects now is, it could be just 15. So it could be the 5 plus the 10, but it could also introduce new side effects. So the side effect profile may actually be now be greater than 15. However, earlier I mentioned for high blood pressure, there are some medicines that are combined in order to treat the condition. But usually, what happens is that first the patient takes drug A, and we know they're not having any side effects from drug A. And then, if their blood pressure is not well controlled, then drug B is introduced, and then we see how the patient tolerates drug B. And then once a patient becomes stable, the blood pressure becomes stable on both drug A and drug B. Now, if drug A and drug B has a combination pill, which basically is both of those medicines in one pill, now we say, okay, patient Y, you can now try to take this combined pill that has both drug A and drug B, because when you were taking them separately, you didn't have any side effects and you tolerated it really well. And so that's typically how that process is done. You don't want to just go throwing any medications together, because it just doesn't really work necessarily the way that you may think it's going to work when it's completely different conditions, um, and completely different mechanisms of action. So I hope that answered that question for that person. Um, any additional questions for me? Once again, thank you all for, joining me this evening. Thank you for the great questions that you've been having so far. If you have any additional questions, please feel free to add them in the chat or just to send me a message on one of the social media platforms at Amize Health on Facebook, Instagram, TikTok, or LinkedIn. And I'll just keep checking that to see whether or not there are any questions coming through there. Okay. I am so glad that we are having this conversation, because it really is a critical conversation to have. And a big part of the reason for it is because I see so many patients who end up not taking the medicines the way that they're prescribed. And one of the things I'll speak about diabetes in particular is sometimes people feel like, okay, I don't feel like giving myself this shot of insulin, so I'm just not going to take it. Or I'm going to ration the insulin out and I'm just going to take, instead of taking the 10 units my doctor prescribed, I'm just going to take two. And, people do that. But what happens is you end up with hyper, meaning high blood sugars, and that high blood sugar can become keep increasing until it gets to a critical stage. And in that critical stage, you end up now having to go get seen in the emergency room, or you end up hospitalized because of the complications of not taking your medications appropriately. Some people say, well, when I feel like my body feels like it needs the insulin, I'll take it then. And they do that. But again, I caution you, because small insults, meaning small injuries over time, sometimes can add up to larger injuries. And uncontrolled high blood sugars or uncontrolled high blood pressure increases the risk of stroke. It increases the risk of other cardiovascular problems, and potentially can lead down the path where it is fatal. And so you really are taking chances by not taking the medicines as prescribed. Now, that's the kind of chronic, chronic medication talk, which is take the medicines. This is your daily medicine. Take it as prescribed. But I'm going to go into when you are prescribed, like let's say an antibiotic. You come in for an antibiotic, and you feel like, okay, after you're prescribed a 10-day course, let's say, of an antibiotic, and after 5 days you're like, or 3 days, three to 5 days, you're like, I feel better. Why should I even take the rest of this? Really, I would, if you are prescribed a certain number of days of a medication, there's a reason for that. It was likely tested and proven that for that specific type of infection, that length of time is necessary to get rid of that infection. So, oftentimes, what will happen is you're feeling great after day 3, or you're feeling great after, you know, the, um, excuse me, you're feeling great after day 3 or day 5, and you feel like, okay, I don't need this anymore. But the whole reason for why you need to continue is because that infection is likely still lingering. And when you stop taking that medicine, what will happen is then you allow antibiotic resistance to potentially crop up. That's one issue. And or the medicines, which is basically the medicines are just not going to work for you as well as it did before. Um, and so I would just be cautious about that. Okay, so you want to make sure you take the medicines the way that it's prescribed to get rid of that infection, and also to prevent antibiotic resistance, because that's really one of the ways that antibiotic resistance develops. Okay, any additional questions regarding that? Any additional questions? I'm so glad that you guys have all these wonderful questions, and we're having this conversation. And I hope that it's really helpful to I hope that it's helpful so that you guys can um, not only start taking your medicines the way it's prescribed, but just have better health overall. So a lot of the concerns, like I said, these concerns that we've been talking about, that the AMA talked about, and why patients don't take their medicines as prescribed, a lot of the reasons are things that really can be addressed. They are things that can be addressed. Now, if for those of you who are listening, if you want to tell me about a reason why you may not be taking your medicine, so that I can help, maybe either enlighten you or help to kind of, because if you're having that issue, likely other people are having that same issue also. And what we're here to do is help each other to live longer, live better, live amazing lives, right? So if there's a reason why you may not take your medicine as prescribed, please let me know, and I'm happy to answer it. So while I'm waiting for those questions, I will say that I myself, you know, I won't. If I am prescribed a medication, I do take it as prescribed. I don't, I'm not the best when it comes to taking medications. I just am not, as many of us are not. So what I do is one of the suggestions that I made to you, which is I have to set an alarm. I have to make sure that, there is something to remind me to take it, because if I don't, then I might forget. I also lean on my loved one to be like, hey, you know, you need to take your medicine. And I'm thankful that I have that I can have someone that's invested enough to say, hey, take your medication, it's for your health. So the things that I'm talking to you about, as much as I want you from the perspective of a physician, I want you to really take charge of your health and learn ways to overcome medication noncompliance. I speak to myself also, because I want to make sure that I'm not only here for my children, but I want to be here for my grandchildren, and I know that many of you want that also. So I do encourage you that if you are having an issue that is preventing you from taking your medications the way you should, let's talk about it. Okay? Or if it's something you need to talk to your doctor specifically about, talk to your doctor. Definitely talk to your doctor, try to get it addressed. Okay? So any questions for me that I can help address? Okay, so again, so happy to have people joining me. I'm just going to go ahead and check all the social media sites to see whether or not there are any questions that popped up on there. And that way I can go ahead and answer them for you guys. I'm happy to have everybody joining me today. It's been a great session so far. We've had some really good questions. And again, this is such an important topic, and I'm glad that you all were able to tune in and we can have this candid conversation about taking our medicines, because it's important. Now, I'll say that one of the things that I'll mention before, we start wrapping up, is that sometimes the person that is refusing to take their medication is loved one that, oh, and I'll say about my older patients, you know, after you've lived a certain amount of time, you get to make whatever decision you want, right? But your daughter or son, your children, your grandchildren, the reason why they're pushing for you to take your medication is because they want to keep you here longer. So that's what that's about. It's not because they want to hurt you, it's not because they want to repay you for something you may have done when you were younger, when they were younger. It really is because they want the best for you. They want to make sure that you are well, and they want to keep you here for as long as they can and enjoy your presence. And so that's why they want you to take your medicines. And I know that it can be particularly hard to convince our some of our older patients to take their medicines. But I will say, I do come at it from the perspective of, we want you here. We want you here living with us for as long as we can have you with us. And part of that is making sure that the conditions are adequately addressed. That's the best way we can put it. We want to make sure that we keep everything stable so that you can remain here with us for as long as you can. Okay? Any additional questions for me? I'm so glad. Again, so happy to have you all join in. And I am, ecstatic about the fact that you guys have questions for me or have sent in questions. It does make this process go smoother. The purpose of these Q&A sessions is really for you. It's not necessarily for me, it's for you. It's because I do see the need in our community, in the, especially in the African American community, to educate people, because there's a lot of things that I think that many of us don't talk about or are not aware of, or we talk about, but we talk about them with the wrong people, or, get misinformed. And so I want this to become a conversation where you feel free to come and ask questions that are relevant and get answers that you can apply to your life to make things better. So, any additional questions before we close out? And I'll just go ahead and check social media another time. Again, so happy to have you guys on. And I'm going to just make sure there are no questions waiting for me on these other platforms. Okay. So I believe I have answered all the questions that are listed. I do want to kind of go just say the last few kind of takeaway points, which are really the main points that I discussed in the previous videos, which is making sure that any concerns that you're having about your medicines, really the person that's prescribing them should be able to answer them. They really should. Don't be afraid to ask those questions. It's for your good. It's for your health. Ask those questions, okay? There are ways, if you are having difficulties with the cost of your medicine, there are ways to minimize the cost by either taking the generic version, maybe trying a different pharmacy, or using a coupon savings program. There are ways to decrease the cost. Now, one of the things that I did not touch on before, and I think I did in previous video, but I did want to say this here, is a lot of us go to our doctors after we've seen commercials on TV. And, you see the commercial of the new medicine and you're like, hey, I want to take that medicine. Let me go ask my doctor so that I could take that medicine. And, we go ahead and we do that. And you either get what we can, pushback because we don't want to prescribe you the new medicine off the TV. But people get upset because that's what they want. But at the end of the day, when you go into the doctor's office, you're going in for them to make the decision after years of training to make the decision as to how to treat you. If that medicine that you saw on TV is appropriate and the right medication for you, I don't see most of us saying no. However, if it is not appropriate, or we know how the insurance companies work, if you have not taken what we consider the standard of care, meaning the medicines that have been tried and true and tested, if you have not tried any of those medicines, chances are your insurance company will not approve that brand new medicine that you saw on the TV. And then you are going to come out of pocket a whole lot of money for that. So, the reason why I'm saying this to you is think about it before you say, I want that brand new medicine that's on TV. Now, sometimes it absolutely is appropriate because you've tried the other medicines, they haven't worked well for you, and now this is where you are, and that's why you want to take it. And if that's the case, absolutely go ahead. But just be cautious because that could be the reason why your doctor is not readily jumping to say, yes, let me write you this script. Because they know when you get to the pharmacy what that cost might look like. Okay. And then the next one that I was saying, you know, if side effects of a medicine does not mean that you will absolutely experience those side effects. It means that it's a possibility that it can happen. And we want to make sure that you are aware that this is something that can happen. And then if you feel like you're taking too many medications, talk to your doctor about decreasing the frequency, maybe the doses, or even the number of prescriptions while maintaining your health. And I want to drop the while maintaining your health in there because sometimes people are like, well, I want to be off all these medicines. I don't want to take all of this. And, there is an intersection between where your faith is and what is necessary. And so sometimes when you're saying, oh, I just want to stop taking all of these medicines, it's not possible for us to just say, okay, that's it. We'll stop everything, because the possibility of what can happen when we discontinue all your medicines like that is that things will likely get worse. So tapering sometimes is the way to go. But we want to make sure that whatever change, whether it be the frequency of medicines, the dose of medicines, or the number of prescriptions you're talking about, if we're making changes, we want to make sure that those changes are not going to negatively impact your health. Okay. So it's a conversation. You have to have that conversation with your doctor, because if you don't, and just go in saying, "Oh, I just want to be off this," without any rhyme or reason, I think most of us is going to say, we need to understand. We need to understand why, because sometimes the reason why is something that we can address. So please have a conversation with your doctor. Also, when you don't have symptoms, after you've been taking a medicine for a while, or maybe you're not even on a medicine, and you're like, I don't have any symptoms of anything. Why do I need to take a medicine? I'll use high blood pressure as an example again. You know, if you are not having symptoms, it doesn't mean there's not a problem. You can have high blood pressure and you're not symptomatic yet, or you can have high blood pressure, get placed on medicines, the medicines get rid of your symptoms. It doesn't mean you stop the medicine, because stopping can cause potentially rebound of symptoms or worsening of symptoms. So a lack of symptoms does not mean you should stop your medicine. It may just mean the medicines are doing their job to prevent you from having symptoms. Or if you are not having symptoms basically yet, like let's say that you haven't started medicine for high blood pressure yet, and you're like, I'm not having symptoms, why do I need to take it? Well, sometimes there's changes that are happening that you're not physically able to notice. Like, um, there are changes in your lab values, for instance. Or sometimes that headache that you're feeling is not just that, it's not just a headache like, oh, somebody annoyed me today. That headache could be from your blood pressure, but you just didn't attribute it to that. So, not having symptoms doesn't mean you should not take your medicines. And then the next one is to get over mistrust and worry. Communicate with your healthcare team. You have to start with communication. Like I mentioned earlier, if you can find someone, a doctor that you trust. If you trust someone that looks like you, great. If you find a doctor that doesn't look like you and you trust them, great. We just want to make sure that you are being seen by somebody who is going to take care of your health. If you don't have a good relationship, or you feel like I can't trust this person, guess what? There are other doctors. Find one. And you can find one. There are many of us out here. Okay. And then the last point, reminders, pillboxes, alarms, or even an accountability partner or someone in your support system can help you to remind you to take your medications. So there are ways to remember if you're forgetting. Okay. um, Pillboxes, alarms, an accountability partner, a support system, reminders, all of these are ways to remember to take your medicines. The more you do it, if you are someone that has a chronic medical condition, and you are taking medicines for long term, um, the more you do it, the more likely you are to remember. Okay. So over time, it just becomes a part of what you do and you will remember. So that's all the things that we went through from the American Medical Association list of reasons why patients don't take their medicine. So I'm going to ask one last time, any additional questions before we get off? If you can't type it into the box, be sure to send me a message on one of the social media platforms. I'm checking right now to make sure there aren't any last minute questions that I can answer. Happy to answer any questions that you guys have. And that's it. So I'll give it another minute or two. Once again, thank you so much for joining me. We have a Q&A session every fourth Monday of the month. And usually it's on the topic that I have been sending out these little short or mini videos about for the previous 3 weeks. So every Monday I will drop new information. And then every fourth Monday at 8 p.m. right here on the Amize Health YouTube channel, we'll have a Q&A session. If you guys have specific topics that you want me to start talking about, absolutely let me know, and I will be sure to kind of, get that in. If you are interested in having me speak at some event that you're having, absolutely send me a message on one of my social media platforms or on the website www.amizehealth.com, and I'll be happy to respond and kind of get information from you about that. It is my pleasure to educate people. This is, more than just Dr. Thorpe just doing something. It is something that I am quite passionate about, and I just want to make sure that we are living our best, amazing lives. And if I can do something to help you guys achieve that, I'm absolutely going to try. So, any questions, like I said, send them to me. If you have topics you want me to cover, send them to me. Um, Definitely follow me on one of my social media platforms. Follow me on this YouTube channel. Be sure to not only like, but also to share with others so that they can have this information also. Okay? So, since no one has any last minute questions, it's been my pleasure. You all have a wonderful night. Until we talk again in the next Q&A on the fourth Monday of next month. Okay? Have a great night. Take care. Bye-bye.